Air pollution affects millions of people around the world today. Today, we will discuss by this video what is air pollution, causes, health effects, international standards, prevention and control strategies. Let us see now. Come with me and see till to end in this video, then drop it in the comments section your assumption. What is air pollution? Air pollution is contamination of the indoor or outdoor environment by any chemical, physical, or biological agent that modifies the natural characteristics of the atmosphere. Household combustion devices, motor vehicles, industrial facilities, and forest fires are common sources of air pollution. Pollutants of major public health concern include particulate matter, carbon monoxide, ozone, nitrogen dioxide, and sulfur dioxide. Outdoor and indoor air pollution cause respiratory and other diseases and are important sources of morbidity and mortality. WHO data show that almost all of the global population, 99%, breathe air that exceeds WHO guideline limits and contains high levels of pollutants, with low and middle-income countries suffering from the highest exposures. Air quality is closely linked to the Earth's climate and ecosystems globally. Many of the drivers of air pollution, e.g. combustion of fossil fuels, are also sources of greenhouse gas emissions. Policies to reduce air pollution, therefore, offer a win-win strategy for both climate and health, lowering the burden of disease attributable to air pollution, as well as contributing to the near and long-term mitigation of climate change. Bad air quality and air quality redirect here. For the obsolete medical theory, see miasma theory. For the measurement of air pollution, see air quality index. Air pollution is the presence of substances in the air that are harmful to humans, other living beings, or the environment. Pollutants can be gases, like ozone or nitrogen oxides, or small particles like soot and dust. Both outdoor and indoor air can be polluted. Outdoor air pollution comes from burning fossil fuels for electricity and transport, wildfires, some industrial processes, waste management, demolition, and agriculture. Indoor air pollution is often from burning firewood or agricultural waste for cooking and heating. Other sources of air pollution include dust storms and volcanic eruptions. Many sources of local air pollution, especially burning fossil fuels, also release greenhouse gases that cause global warming. However, air pollution may limit warming locally. Air pollution kills 7 or 8 million people each year. It is a significant risk factor for a number of diseases, including stroke, heart disease, chronic obstructive pulmonary disease, COPD, asthma, coronavirus, and lung cancer. Particulate matter is the most deadly, both for indoor and indoor air pollution. Ozone affects crops and forests are damaged by the pollution that causes acid rain. Overall, the World Bank has estimated that welfare losses, premature deaths, and productivity losses, lost labor, caused by air pollution cost the world economy over $8 trillion per year. Various technologies and strategies reduce air pollution. Key approaches include clean cookers, fire protection, improved waste management, dust control, industrial scrubbers, electric vehicles, and renewable energy. National air quality laws have often been effective, notably the 1956 Clean Air Act in Britain and the 1963 U.S. Clean Air Act in 1963. International efforts have had mixed results. The Montreal Protocol almost eliminated harmful ozone-depleting chemicals, while international action on climate change has been less successful. What are the common causes of air pollution? Air pollution consists of gases and particles suspended in the air that can harm human health and the environment. These pollutants can be directly emitted, primary, or formed through chemical reactions in the atmosphere, secondary. Here are the most common air pollutants, their explanations, and how they affect the body. 1. Particulate matter, PM10 and PM2.5. Explanation: particulate matter, PM, is a mixture of microscopic solid particles and liquid droplets suspended in the air, including dust, dirt, soot, and smoke. These particles come from natural e.e. volcanoes and man-made sources, e.e. traffic, industry, combustion. They are hazardous to health as smaller particles can enter the lungs and bloodstream. A mixture of tiny solid particles and liquid droplets in the air. PM10, inhalable particles, dust, pollen, less than 10 micrometers in diameter. PM2.5, fine particles, soot, smoke, heavy metals, less than 2.5 micrometers, smaller than a human hair. Sources: vehicle exhaust, power plants, wildfires, wood burning, construction dust. How it affects the body: these particles penetrate deep into the lungs. PM2.5 can even enter the bloodstream. They cause inflammation, worsen asthma and bronchitis, reduce lung function, increase the risk of heart attacks or strokes, and are classified as a carcinogen, lung cancer. Let us see standards. Particulate matter, PM, standards, which define safe atmospheric concentrations of harmful particles, are primarily set for PM2.5, fine, and PM10, coarse particles. The World Health Organization, WHO, guidelines recommend an annual average of 5 micrograms per meter cubed for PM2.5 and 15 micrograms per meter cubed for PM10. whereas the US EPA maintains higher, legally enforceable levels of 9 micrograms per meter cube, PM2.5 annual, and 150 micrograms per meter cube, PM10 for 24 hours. Particulate matter, PM, prevention and control involves a multifaceted approach, ranging from industrial-scale technological solutions to individual lifestyle changes, focusing on reducing source emissions, enhancing atmospheric dispersion, and protecting public health. Key strategies are diagrammed into 1. Industrial and engineering controls, source control. These technologies are designed to remove particles from industrial exhaust gases before they are released into the atmosphere. Electrostatic precipitators, ESPs, use electric charges to collect particles on plates, highly efficient, 99.9%, for both coarse and fine particles. Fabric filters, baghouses, use fabric bags to filter dust from gas streams, highly effective for submicron particles. Cyclone separators use centrifugal force to separate large particles, often used as pre-cleaners. Wet scrubbers use a liquid stream to wash particles out of gas, effective for high-temperature, high-humidity streams. Production process changes, using cleaner fuels, e.e. natural gas instead of coal washing to reduce ash, and implementing fluidized bed combustion. 2. Environmental and structural control. Energy structure optimization, reducing reliance on coal, promoting cleaner energy sources, and improving energy efficiency. Transportation management, promoting electric vehicles, improving public transport, and implementing vehicle maintenance programs to reduce exhaust. Urban greening, planting trees and creating green spaces, which filter pollutants and reduce urban temperatures. Dust management, controlling construction site dust and sweeping roads. 3. Policy and regulatory mechanisms. Emission standards, setting and tightening air quality standards, e.e. WHO guidelines. Regional cooperation, joint prevention and control mechanisms across cities, e.e. regional joint action plans for haze. Polluter pays principle, imposing environmental taxes or penalties for non-compliance. Environmental monitoring, using satellite imagery and ground monitoring stations to track air quality. 4. Personal and indoor exposure mitigation. Air purifiers, using high-efficiency EHFA air cleaners indoors. Ventilation management, closing windows during high pollution, bad air days. Indoor source control, avoiding smoking indoors, limiting incense or candle burning, and using exhaust fans while cooking. Protective gear, wearing N95 masks during high pollution days. 5. Agricultural management. Biomass burning control, replacing open burning of agricultural waste with sustainable methods like bioenergy conversion or straw returning. Conservation agriculture, reducing soil disturbance to minimize dust. Co-control strategy. Multi-pollutant control, simultaneously controlling sulfur dioxide, SO2, nitrogen oxides, NO2, and volatile organic compounds, VOCs, to reduce secondary PM formation, specifically ammonium nitrate and sulfate. 2. Ground-level ozone, O3. Explanation, a colorless gas found at ground level. Unlike the protective ozone layer high in the atmosphere, ground-level ozone is the main ingredient in smog. It is a secondary pollutant formed when nitrogen oxides, NO2, and volatile organic compounds, VOCs, react in sunlight. Sources, chemical reactions between emissions from cars, power plants, and refineries on hot and sunny days. How it affects the body, it acts as a powerful lung irritant, causing chest pain, coughing, throat irritation, and airway congestion. It reduces lung function, triggers asthma attacks, and can cause permanent lung damage over time. Standard of ground-level ozone. The current US EPA National Ambient Air Quality Standard, NAAS, for ground-level ozone is 0.070 ppm, or 70 parts per billion ppb, based on an 8-hour average. This limit is designed to protect public health and the environment, focusing on the 3-year average of the 4th highest daily maximum, established to mitigate risks like respiratory issues. Prevention and control mechanism. Ground-level ozone is formed when nitrogen oxides, NO2, and volatile organic compounds, VOCs, react in sunlight. Key prevention includes reducing emissions from cars, industrial sources, and power plants, as well as using cleaner fuels, painting, and lawn equipment. Control involves daily actionable steps like limiting driving, refueling at dusk, and increasing energy efficiency. 3. Nitrogen dioxide, NO2. Explanation, nitrogen dioxide, NO2, is a highly reactive reddish-brown toxic gas and a major air pollutant primarily produced from burning fossil fuels in vehicles, power plants, and industrial processes. It is a key component of nitrogen oxides, NO2, causing respiratory issues, contributing to acid rain, and forming ground-level ozone and smog. A harsh-smelling reddish-brown gas that belongs to a group of reactive gases called nitrogen oxides, NO2. It is a major indicator of traffic-related air pollution. Sources, combustion of fuel in vehicles, power plants, and industrial facilities. How it affects the body, it inflames the lining of the lungs and reduces immunity to respiratory infections. It causes wheezing, coughing, and worsened asthma and bronchitis. Standard nitrogen dioxide NO2 levels are regulated air quality guidelines designed to protect human health, primarily focusing on reducing respiratory issues caused by vehicle emissions and fuel combustion. Key standards include a 1-hour limit of 100 ppb or 190 to 200 micrograms per meter cubed, and an annual average of 53 ppb or 40 to 100 micrograms per meter cubed. Nitrogen dioxide NO2 prevention and control focuses on reducing combustion emissions via cleaner energy, electric vehicles, renewables, improved industrial technology, low NO2 burners, scrubbers, and reducing indoor sources, venting gas stoves. Key measures include upgrading to electric equipment, proper HVAC maintenance, and promoting sustainable transport. 4. Sulfur dioxide, SO2. Explanation, a colorless gas with a pungent, choking odor. It is highly reactive and forms sulfuric acid in the atmosphere. Sources, burning fossil fuels that contain sulfur, primarily coal and oil in power plants, as well as metal smelting. How it affects the body, it causes immediate irritation to the nose and throat, shortness of breath, and tightness in the chest. It is particularly harmful to people with asthma and causes chronic bronchitis.
The US EPA National Ambient Air Quality Standard, NAAS, for sulfur dioxide, SO2, is 75 parts per billion, ppb, based on a 3-year average of the 99th percentile of 1-hour daily maximum concentrations. This primary standard, established in 2010, protects public health, particularly for individuals with asthma. Carbon monoxide, CO, exposure standards typically dictate a maximum 8-hour time-weighted average of TOR in workplaces to prevent health risks, with residential safety-rated alarms designed to activate at higher levels, e.e. TOR after 4 hours. OSHA and other health bodies emphasize keeping CO levels as close to zero as possible. 5. Volatile organic compounds, VOCs. Explanation: a large group of carbon-based chemicals that easily evaporate at room temperature. They are major contributors to the formation of smog. Sources: paints, varnishes, cleaning supplies, gasoline, solvents, and industrial chemicals. How it affects the body: short-term exposure causes eye, nose, and throat irritation, headache, and dizziness. Long-term exposure can cause damage to the liver, kidneys, and central nervous system, and some are known carcinogens, e.e. benzene. VOC standards are reference materials, regulatory limits, and testing methods, e.e. EPA 826, ISO 17025, designed to measure and control hazardous truck and base chemical emissions that evaporate at room temperature. These standards ensure compliance for air, water, and soil quality, as well as products like paints and coatings, with acceptable total VOC levels often below 0.5 milligrams per meter cubed.